name is Priyanka and my channel's name is Creations. So this is my first video on the YouTube. I hope you like it. This topic is pre-delivery care during Corona. Basically, I'm a mother of a kid who is 1 year old and I delivered a baby boy on 8th April 2020. Yes, during lockdown. It was actually a very tough period for me and my baby too. But after sailing through it, I think the most important thing one should keep in mind is thinking positive, which I did. And my pregnancy was, yes, very complicated. I am a liver donor. I have donated 65% of my liver back in December 2016. And we'll talk about it later. And I was also a diabetic patient during my pregnancy. I had gestational diabetes. So yes, the journey was already tough, and it became tougher when it came to coronavirus and lockdown. So let me share my experience with you. Hope it helps you in your delivery and post delivery. See, everything is not in our hand. Basically, what we can do is we can first of all think positive. I know it's the toughest situation, it's the toughest thing in today's scenario, but we have to think because it is not only about us but also about our baby, not only about the delivery but post delivery thing also. We need to be strong enough mentally as well as physically to deliver a healthy baby and take care of it. So what precautions should be taken by a pregnant woman to deliver a safe baby? It is nothing rocket science. You have to take the same precaution as general public is taking. Hygiene, you have to maintain a good hygiene. Wash your hands again and again, sanitize them. Yes, do use a sanitizer which have less alcohol because it'll be like harmful to the baby as well as yourself. Is the question which I also asked during my pregnancy. Is a pregnant lady is at more risk than any other person for coronavirus? And the answer which my gynaec gave me is no. A pregnant lady is not more at risk, but once infected, it can get worse. And ladies who already have lung disease, liver disease, kidney disease, or diabetic, they are at risk. And I was one of them. I was a liver donor as well as I had gestational diabetes. So really I was wondering that how can I give a birth to a healthy baby? Is it because of my physical health that I can get infected? Or the situation is same for it? Number one, I stayed away from public meetings. I stayed away from people. I was only in touch with my brother, with my mother, with my husband, as my husband was doing job, but because of the lockdown he had to stay with me for another 3 months. And lockdown happened in 21st March 2020, and I delivered a baby boy on 8th April 2020. So yes, it was a tough time. I had actually bought few clothes from my baby beforehand, so I was not that worried. But yes, I was worried that what if I get infected? What if anybody else get infected? So we actually maintained social distancing. We actually went less to doctor visits. I know that was a high time, but I managed it through phone calls and through other things. I followed some exercises that were, number one was Kegel exercise that my doctor asked me to do for a safe delivery of baby, for making my uterus strong. For Kegel exercise, you can visit Google. Because of this coronavirus, I followed some other exercises. Brisk walking and Kegel exercises were something which I used to follow before this coronavirus and lockdown period. But few exercises I started later on after the pandemic, after the lockdown. They were the breathing exercises. Yes, breathing exercises. It helped me to maintain my oxygen level because during pregnancy already you have a problem. You have a problem like suffocation. You sometimes have to deep breathe. You sometimes feel suffocated. You feel uneasy. And these all things can be linked very easily to COVID-19, because in that also you have less oxygen supply. You can see through it that people here are suffering because of that. So I actually had some breathing exercises. Talking about some breathing exercises, number one is chest breathing exercise. Number 2 is a belly breathing exercise. Number 3 is crossed leg slow breathing exercise. And apart from these exercises, there is also Sheetkari and Sheetali Pranayam that I followed from Baba Ramdev, and it really helped me to reduce the heat of my body during pregnancy. And if you want me to talk about these exercises in detail, do write in the comment section below. I will make a video of how to actually do these exercises, how to follow these exercises, and how many times to do it. Rest, it is also present on Google. You can Google it and do it. Slow breathing, expulsion breathing, faster breathing, these are all a part of exercise. Basically, they not only help you to cater with the coronavirus or to fight with coronavirus, or not only to maintain the oxygen level, but also during the safe pregnancy. It helps you to deal with the morning sickness, it helps you to get rejuvenated and have a peaceful sleep, and also manages your delivery pain in case you're going for a normal delivery. Talking about the delivery process, mine was a complicated case, so I have to go through C-section delivery. So during C-section, you are first of all mentally prepared that okay, you don't have to wait for the pains, and I think this is a boon in this COVID-19. This is a boon, really, because you are mentally prepared that okay, this is the time that you're going to get admitted, and that is the time that you are going to be tested for corona, whether you are positive or negative. And by God's grace, I was completely negative that time. My coronavirus was negative and I was positive in my thinking. We had a planned delivery, and before delivery I had a complication that I got my alkaline phosphate increased to a level that I got allergy all over my body, including my stomach. That was really very painful. I was admitted 2 days before my delivery planned, and I had to take one injection that a person takes when she has gestational diabetes. So I was in complete monitoring, as well as I had a doctor's team where the liver specialist was also present. My gynec was also there, anesthetist was also there, and everything was taken care of. So the day came, I went for my delivery process. I was COVID negative, and I went there at 10, at 9:30 or 10, and I delivered a baby boy on 10:52. Apart from that, I had few questions which I asked my gynec, and she catered all of them very well. Number one was that can I delay my antenatal visits because of this pandemic? So the answer was yes, of course. We can have video call, we can have video call conversation, we can get our test done and show the report on WhatsApp. Nowadays, media is at another level, so you need not to worry. But on the other hand, if you're suspicious about something, if you think that the baby's movement is not well enough, or if you think that there is something which is wrong with you or your baby's health, you can always go in emergency. Please do not delay. Please do not delay. It can be very hard. Coronavirus and breastfeeding. If you think that you are positive and you come positive by any way, so if you are COVID positive, then can you actually feed your baby? Can you actually breastfeed your baby? This is the most important questions many of them asked. Yes, baby has the risk of catching the virus, but breastfeeding always outweigh the risk of getting him infected. And the risk also slows down. The immunity increases. If you are corona positive and you are breastfeeding the baby is developing the antibodies to fight for the same. And this is true in every sense. Because I had fever, and I actually thought after 2 months that I shouldn't breastfeed my baby, because I was in a dilemma that whether it's COVID-19, am I positive? I was in a dilemma. I asked my doctor, and she said that if you have fever, do feed your baby, because your baby is going to develop the antibodies against the disease, antibodies against the infection, and that was something which was new to me. So I breastfeeded my baby, and I'm still breastfeeding him, and I try to give him as much as I can, because in this COVID pandemic, I think breastfeeding is way more like medicine to the babies. One more question is there. I don't know whether we should talk about it or not, but I have heard it many times. Actually, a mother is very emotional, And an emotional mother always gets, so much attached to her baby. The baby which she has kept in her womb for 9 months. And now the baby is outside the womb. It is your part. So, can you have skin to skin contact if you are COVID positive? Yes, you can have it, but with all the precautions. With all the precautions, you can ask your doctor to give you skin to skin contact because the baby touches the cheek of a mother, nothing else. So, you can take away, you can have your breastfeed in a bottle. You can ask your doctor to give that feed to the baby. That no matter how healthy you are, whether you are diabetic or non-diabetic, whether you are a BP patient or not, but please carry a BP monitoring machine with you all the time. Please have an oximeter, pulse oximeter with you, and a glucometer. And number four, you can also, a thermometer is a must. I think that's available at everybody's place. So these are the few things which should be with you at every time, at all the time. Do take your vitamin C plus zinc intake. Do have tulsi tea, haldi doodh, and long, which is like very important. And all the nuskhas, please take it with caution. These are the two, three things which are like, it's okay to take, but other things, do take advice from the doctor. Do not follow anything blindly. Please do not follow. So I think this is all for today's video, and I would like to share with you my experiences, how I sailed through my pregnancy, what all complications I had. If you want to know about it, do like and do comment in the section below. And I will also come up with other video, that is what to carry in a hospital bag when you're going for delivery. Your baby's bag and your bag. And there are a lot more to come. If you want anything else, especially, do comment. And if you have any queries regarding anything, please write down in the comment section below. Kindly like and subscribe to my channel, and we'll get back to you with more such videos, more such informative videos, and my experiences. Thank you. Have a good day. Take care. Bye.